Thank you, sir.
No problem.
Hi, Professor.
Yes.
Basically, I missed the last class due to some schedule conflict, but I will continue to attend in-person class in future. One thing is I followed the video lecture you have shared. So, how to review the report? Have you shared any format? How to write that one? Like,
Yes.
For particle or format?
Yeah, I will talk about in the beginning of the class.
In
Yeah.
students.
Yes.
Okay, I missed this, so I thought I have missed that part.
Yeah, I will show you a couple of.
Okay.
Yeah. Okay. Okay, good afternoon, everyone. So let's get started. Before we begin the lecture, I just want to quickly give you some updates. If you go to this web course, you see I released the assignment. So the paper review, so we all have 5 papers for review in total. So some of the review guidelines I already mentioned in my last lecture. So this is a self-paced homework. So we do have deadlines specified here. These 5 papers, they have different topics. So some of them maybe like focus on self-supervised learning. Some of the papers focus on multimodal learning. So if you are not familiar with the topic, maybe you can wait till, we have a course lecture, the schedule, right? So we have a tentative schedule. So if you are not familiar with self-supervised learning, we have a couple of classes. We'll talk about some of the fundamentals. So you can wait till these lectures has been given, so you are more familiar with the topic or some of the techniques. Then you can go back to these assignment. I believe there's one. Let me see. So I think maybe this one. Yeah, this contrastive learning, right? So basically it's a self-supervised learning technique. So maybe you can wait till we've talked about self-supervised learning, then you go review the paper. I think it's after, the deadline is after when we go give those lectures, okay? And I also give you some examples. So one student asked me, right, so what is the format, right? So do you have any examples that we can follow? Yes, we do. I do provide some examples, right? So these are the examples I took from my previous class. So some of the report, I feel like they are very good, very good. So I basically give you like 2 or 3 examples, right? So how those report has been, constructed, right? So different, especially the weakness session, right? How they are coming up with comments with different aspect. Here I also give you some of the very brief guidelines, right? So these reports will have these different sessions. So make sure you check the examples, and also when you prepare the report, I also provide a template. So if you're comfortable with the Word document, you can use in the Word template. If you feel like I want to use in the LaTeX, so this is a LaTeX format as well. Okay, I don't have a page limit, but minimum is like 1 page. But if you feel like, okay, this is a really interesting paper, or you do familiar with the topic, you have a lot of thoughts, you want to write a lot of comments, that's great. So you can, have like 2 or 3 pages. So that's totally fine. Okay. So these are the, give you some examples you can follow. So that's the paper review assignment. Yes.
What is the part that your rating is given? So it's kind of like, will I rate the paper something like this, or like how the justification will be related to the rating? What I mean, the weak accept and weak reject, how we will differentiate those?
Yeah, so this is just give you a sense like you're performing like a conference reviewer, right? So, the weak accept means like maybe the novelty is okay, is good. It is interesting, but it's not perfect. Maybe some evaluation or some ablation is not enough. So you feel like you still need, the author needs to do some, maybe more experiment or enhancement. But it's not a deal breaker, right? So totally unacceptable. So this can be considered as a weak accept. But the borderline is like, okay, maybe it's not that novel, but it is something interesting. And also, it's basically like you are on the edge, right? So there's maybe not something very significant, caught your attention, like you feel like you want to champion the paper, right? So that's the borderline. Sometimes, a lot of reviewers, in the first round, they feel like, okay, it's really difficult for me to decide if I want to champion or maybe just encourage this paper. I can give a borderline, but I will have a lot of detailed comments. So in the rebuttal period, so the authors should focus on their effort to provide a very strong rebuttal, trying to convince me, okay, this is an acceptable paper. So that's the borderline. But on the negative side, if you feel like, okay, there's some major limitation during the rebuttal period, maybe like a week or so, it's not possible for them to complete everything. For example, you are missing a couple of major experiments, or the technical novelty is really limited, or there's some technical flaw in the methodology. It's totally need to kind of rewrite everything or redo all the experiment, then that is maybe not an acceptable paper. So you can go to the negative side, right? Reject or weak reject. Okay. So besides the paper review, we also have the programming assignment. We have 3 of them. So I also release all of them. So again, this work at your own pace. You don't have to, finish everything, quickly. So the reason I release all the assignment, because I know some of you guys taking other classes, maybe also have programming assignment. So this is just to give you a heads up, right? So there's due date. So to avoid like conflict or overlap with several projects due, you may want to consider if you want to finish this assignment early, or maybe the assignment from other course early. Okay. So all those details are there. So while you're doing the assignment, if there's anything you are not clear, or if you are struggling with some issues, feel free to reach out to me and also the TA. So the TA can give you some assistance if there's any trouble. Okay. And also I also released the project idea, a couple of them, so you can read a couple of these documents. As I mentioned, this is not a comprehensive list. I just provide some of the examples, maybe just to inspire you to maybe have some similar idea, or maybe just picking one of them. But you have the freedom to come up with your own ideas, but has to be related to this medical imaging. Okay, so that's a couple of logistics. Any questions so far? Okay. Okay, so for today's class, we'll do a very quick introduction to medical image computing. So we briefly will talk about different medical imaging modalities. Okay. So before we begin, so what is medical imaging? So any thoughts on this? What is medical imaging?
The images which contains medical data like disease data, or some images contain like showing that like X-ray images, something like that, which are used to identify a particular disease. Mm-hmm. These are called kind of the medical images.
Mm-hmm. Yeah. So basically, it's used to produce images of organs, right? So before any of the imaging device has been developed, there's no way to see the internal, structure of our human body. So the only way the doctor examines or knows what's going on is have to cut open, right? So you have to see what's inside, right? But medical imaging, you don't have to actually open the body, right? So because we can, using different imaging modalities, actually to see what's the internal structure, right? Different tissues, different organs, and we can do some diagnosis and provide some treatment. And we have different types of medical images. So they are used for different purposes, right? They can see different things within the body. So that comes to the next question. So why is medical imaging important, right? So why we have to care about medical imaging? Any thoughts?
So we don't have to cut them open?
Yeah, so that's the one. Any other, reason? We are keep, innovating, engineering all these medical image devices, trying to get maybe more clear, better pictures. Yes.
We can detect the disease prior, based on some symptoms before it actually.
Yes. So that's a really good point, right? So basically, we are allowed the doctors trying to find, essentially during the early stage, if we can discover some of the disease in the early stage, or especially the cancer, right? So if in the early stage, then there's a high chance, right, we can cure the cancer. So this will lead very good outcomes for the patient. And also the medical imaging can be very useful in decision making, right? So what kind of treatment, what kind of future care we have to provide for the patient. So radiology is a branch of medicine that using imaging technique to diagnose and treat these diseases. So as I mentioned, right, so this is a really in a high-skilled, domain, so it requires a lot of training. But as I mentioned, this course we are not teaching this, but we are just focused on how we can using some AI or machine learning technique to help us to perform certain tasks. So what medical imaging modalities do you know? CT, yes. MRI. X-rays. Functional MRI, yes. Let's go on. Ultrasound, yes. Very common. EEG, it's not like image per se, but it do show some, signals, right? So if you feel like these time series can be viewed as a matrix, then definitely can be shown as an image. That's also be considered as that, yes. So you guys have been, mentioned a couple of very commonly used, right? X-ray using electromagnetic. So basically using ionized radiation to generate images. And we also have CT, right? So basically advanced X-ray or 3D X-ray, if you can think of that in that way. And we also have ultrasound, right? Using the sound wave to generate image in real time. We also have very powerful MRI, which is really is kind of technical innovation in the medical domain, right? Using the radio wave and also the magnetic field to generate very clear picture of our, especially the soft tissue area of the human body. And we also have a branch nuclear medicine, right? So we have this PET scan, right? That's using the nuclear energy. You have some nuclear tracers to detect, to do the imaging. So the basic concept of any medical imaging system is that, of course, this is a very complex system. A lot of engineering has been put into this. So we have electronics, right? We have control. We also have algorithm to display or reconstruct the signals into something that can be interpretable, right? But the basic concept is that you have some sort of energy source, right? So either this can be like X-ray, right, using ionized radiation, or maybe MRI using magnetic field and also using radio wave. So these energy source emit the energy, then this energy travel through the body, right? Some of the energies will be absorbed by the tissues, organs, right, or maybe reflected. Some of the energies will be, passed through your body, and eventually we'll have a energy receiver or collector, right, to detect those kind of energies as being passed through, and then we can, based on the detect energies, to using computer, computational algorithm to trying to reconstruct into something that is meaningful, right? So there's several requirements for this medical imaging system, right? So here are a couple of, good attributes we want, or desired attributes we want the medical imaging systems. So first is we want to have, some diagnostic contrast, right? So the imaging or the pixel intensity within certain range, you have to show some contrast, right? So if there's no contrast, it's really difficult to tell, which is which. And also has to be has some sensitivity, right? So you're able to detect, different type of tissues and normal tissues or some abnormal tissues. Just for the sensitivity is not enough, right? So we also have some specificity, so that we can use some indicator to tell this is certain type of disease, right? So we can specify, this is certain type of disease. And some of the imaging system requires function, right? Someone mentioned the functional MRI, right? So some of the imaging tells the anatomy of the body, but sometimes we also have to know the function, right? How the metabolism works and how this affects certain function, right? And of course, we want to have high spatial resolution, right? So we are able to see the clear, different tissues and how they, show different characteristics, right? Based on the high resolution. And also the temporal resolution. For some of the imagings, we also want to see how some of the functions evolve during the time, right? So like the blood flow, how they behave differently, right, through your human body. And other characteristics like safety is really important, right? Because you don't want the patient go through the imaging process, but also get hurt, right? So safety is really important, and also has to be fast, right? So you don't want the patient undergoing these kind of imaging process for a long period of time, right? So ideally, we want it to be to achieve this imaging really quickly. And inexpensive, right? Everyone can afford this, and also easy to use, right? So a lot of this kind of health professionals has to operate these machines. If you have a very difficult to use, then it may generate a lot of error, right? So also requires a lot of training for that. Of course, all these different requirements or characteristics may not be satisfied at the same time for one particular imaging modality, right? So sometimes we have to use different imaging modalities like CT with MRI or CT with PET scan together to using this kind of complementary information to make more robust or more accurate diagnosis. So here we can show some of the different imaging modalities and how this kind of engineering advanced over the time and how this imaging quality has been improved, right? So this is the first X-ray from 1895, right? So you can see that this is not very clear, but although we are able to see this kind of bone structure of the hand, but again, it's not very clear, right? But now we have this X-ray of a hand that is able to show very clear, especially these kind of different bone structure. Especially have like bone fractions, you can easily see from this X-ray images. And this is early CT image, right? So not much detail, but we do able to see, has a different contrast and show different tissues, right? This brain, gray matter, white matter, all these things. But now we are able to see much clearer picture. Again, this is not a very clear one, but this is because the example applied is probably low resolution. But now we have much clearer CT image like this. This is the ultrasound, right? Using the sound wave to do the imaging. And here, as if we are not like a healthcare professional or doctors, probably we are not able to tell like which is which, right? So we only see this kind of white or dark pixels. We don't really know, what different tissues or organs that is, right? So it's not very clear. But now we are, with the technology advancement, right? So this ultrasound that has been used a lot in this kind of, OBGYN, right? So we can, see the, kind of infant, right? So we do this kind of examination, so we can see clearly how the body grow over time. And also the MRI image, right? So this is also an example in the early MRI. It's not very clear, has kind of low contrast. But for today, with very high resolution, especially those high energy, maybe over 3 Tesla of magnetic strength, then we can see very clear these blood vessel, soft tissues on the MRI image.
Professor, for
yes.
MRI, which particular organ they use to take MRI? Like whole body MRI, something like this, or the particular tissue of the body?
So the MRI, so it depends. So you can have this abnormal MRI. A lot of time, you have the brain MRI is really used because the brain has a lot of blood vessels, soft tissues, and using MRI is really easy to detect some of the tumor and also we can using functional MRI to analyze some of the function, right? So have some degenerative disease like Alzheimer, dementia, right? So we can analyze the function. So it depends. So you don't have to do like a whole body scan with MRI. It's not necessary. So you have to, based on what kind of disease you want to see, and do the MRI of that particular part. Yes. Okay. So we've just give you like a very quick overview, like what these kind of imaging, different imaging modality look like. So in the next, we'll talk about each of them. So all these different imaging modalities, right? So this is basically, you can look at these electromagnetic spectrum. So basically here, the spectrum shows the wavelengths, right? So like the radio waves, so everyone is familiar with that, right? So in the early days, we have the radios, right? So maybe your grandparents maybe still have the radios at home. So we have this radio waves, right? So which has like 100 meters of wavelengths. Then we go to the shorter wavelengths. Then we have the microwave, right? So every household has a microwave that is able to, heat the food very quickly. And then we have these even shorter one go to this infrared light, right? Like remote control and maybe other devices using the infrared light. Then we have this, visible light, spectrum, right? So from 700 nanometer to 400 nanometer, okay? And once we go even shorter wavelengths, then we go to the X-rays, right? So we can do this kind of X-ray images. Then even shorter, we have these gamma rays, right? So this kind of nuclear, imaging. So if we have the shorter wavelengths, that means we have higher frequency, right? So that means we will have generate a lot of heat or energy, right? So this is, the gamma ray here, this kind of nuclear we can use to generate electricity, right? So the first X-ray image was discovered by the German physicist Wilhelm Röntgen. So he actually, took the first X-ray image, which I showed before in the previous slide, of his wife's hand, right? So this is the first X-ray images. So, and actually the discovery of the X-ray, win the Nobel Prize in physics in 1901. So X-ray or radiograph is basically, you can think about this is like a projective imaging style, right? So you have an X-ray beam, right? Basically, have some ionized radiation and go through the body. And some of them will be absorbed, right, by different tissues, like the bones, right, have very dense. And some of them will be, passed through and will be picked up by the, the receiver. So this is like you can think of this is like a shadow, right? So you generate different shadows of your internal structure. And anyone, taking X-ray before? Okay, so yeah, it's very common. So I think a lot of you guys may taking X-ray. So this is X-ray machine will look like, right? So if you go to the examining or imaging room, so you can either lie down on the table, right? Maybe supine, right? Means you facing upward, and this is the energy source, right? X-ray source. So radiate the some energy, then will be there's a receiver under the table will collect the energy pass through the body. And also you can some of the imagings, maybe you don't have to lie down, you can just standing there. So there's like a wall bucky. So also you can standing there, then taking an image by standing up, okay? There's 5 basic densities, right? So the air, fat, fluid, soft tissue, bone, and metal. So the air, you can completely pass through. So it will display or show as black on an X-ray image. And metal, right? So it's highly dense and attenuate a lot. So it will show bright white on the X-ray image. And the fat and the fluid and bone with different densities will show different shades of gray. Okay. So here is an X-ray image, right? So you can see different structures, right? Especially here, the metal, right? So on the spine. So maybe this patient has gone through some surgery on the spine. Maybe there's a herniated disc or something like that. So did some metal implant. So you can see that this is very clear, right? So very clear, bright white show on the X-ray. And also the bone structure, because it's absorbed a lot of energies, will also show very close to very bright. But like air, so these energy will totally pass through. It will show like a pure darkness on this X-ray. So here you may be wondering, right? So why this metal showing as white, or this, if all the energy pass through like the air, this will show black. Why not reverse? Anyone have any thoughts on this? Like why we display this as a white, why not the other way around? So, this is just a convention of the X-ray display, how they display the X-ray images. So you can definitely do the like inverted X-ray, right? So if you want, you can make the dense material show as dark, the light, density as showing the white. So there's a lot of like windows you can adjust, but by convention, we'll just display like the metal, the very dense structure as a bright white on the X-ray image. And there's several basic uses of X-ray, right? So one common use of X-ray is the used by dental examination, right? So if you visit the dental office, right? So maybe you have to do some tooth corrections, and especially the young child, their teeth is still in the growth or development stages. So the doctors will often using X-rays, right, to see clearly, right? So how different tooth is growing, if one will be block the space with another, right? If there's another tooth growing behind, the old tooth haven't fall out. So this take a very quick X-rays, you are able to see all these internal structures very clearly. Okay. And other use cases like surgical markers, right? Prior to some invasive procedure, right? So maybe you have some fractures of the bone, then you have to do some invasive procedure, do some implant, right? The metal. Then you have to take the X-rays and basically figure out, right? So what is the best, places to kind of implant or maybe those metals. And we're also using X-rays to do the mammography, right? So this is for breast cancer detection. And we can also using X-rays to do the orthopedic evaluation and the checks examination, right? Especially examine the lung, right? So we can also using X-rays, to do the age estimation. So you maybe see some of the TV shows or sci-fi movies, right? So the forensic team taking, digging some bones where you want to identify or maybe determine the age of the bone, right? So you can using X-ray to do that, to make an image and to do the analysis. Okay, so this is a concrete example of showing the mammogram, right? So basically the X-ray, breast X-ray. So on the left side, this is the benign case, right? So non-cancerous example. Although you can see some of them, like a lump showing in the white area, but this is maybe more like a benign case, right? So it's not very serious. Maybe we can still cure that. But on the right side, we have showing a malignant case, right? So it's this area has high density tissues, and we can note, based on this X-ray image, actually the radiologist will measure the size or the volume. If you're using like 3D, you can actually measure the volume, and also the shape, right? So we can do these kind of measurement, then later using that to do the diagnosis. And this is, a clinical exam, right? So of these different bone structure of the body part, right? The wrist, hand, forearm, pelvis, elbow, etc. And we can using X-rays to do the fracture detection, right? So we can take multiple images, right? Maybe from different angles. Then, we can accurately determine, right? So how long is the fracture? Where is the fracture, right? So then we can, the doctor can take the, corresponding procedure for that. Okay, this is another example of the lung X-ray, right? So the radiologist will read this chest X-ray image and trying to search for some abnormal patterns, right? So have a pneumonia, then we'll search for certain patterns for that. So typically there's some of the things this kind of radiologist were looking for, right, based on these X-ray images, right? The size, dimension, the volume will describe some of the patterns, right? So maybe very dense, opacity, all these things, and also the location and how a specific abnormal pattern will interact with nearby structures, and also the intensity, distribution, shape, all these things, okay? But this is not an easy task, right? So for some of the experienced radiologists, they may take some time to figure out. But again, because this X-ray using a very small dosage of radiation, and also as I mentioned, you can think of this is like a shadow or projection, right? So as you can see from this X-ray, there's a lot of overlap of different structure, right? The rib cage, right? The ribs, or maybe other organs, so it has a lot of shadow. So the images, sometimes can be very noisy. So, and the blood vessels, can also be seen as like small nodules, which sometimes will confuse, some actual abnormality. And because of these, right, so radiologists may miss some of the patterns. So that's why, we can using, computer algorithms, while using AI algorithms to train a very good model. And hopefully that can, kind of assist the radiologist, right? So basically you can think of this like a human in the loop, right? So you can using the AI to help generate some of the diagnostic patterns, doing some detection, right? Bounding box, and then generate some report, and the radiologist can verify and also do the second examination, like a recheck some of the things. Maybe the AI algorithm can detect something that is being missed by the radiologist, right? So this is the purpose of this course. Okay, so all these are different use cases for the X-ray. So here, I want you guys to think about if there are any other X-ray use cases you can talk about for our daily life. Yes. Security, right? So everyone go to the airport. So you have to go through the X-ray machine, especially luggage, right? So, so this is the image of the X-ray during the security scan, right? So you don't have to open the box, the luggage, and it will automatically detect some of the metals, right? So really show very clearly what's inside in your backpack or luggage. So besides this security, what other use scenario?
I think it would probably be a kind of similar scoping of security, but potentially bomb disposal. So like looking at, trying to see what's inside, figure out.
Yes.
IEDs.
Yes. Yeah. The bomb could be also because opening something could be some sort of trigger, right? So you don't want to go near. So we can using this kind of X-ray image to see what's inside. And this kind of bomb detector usually will also be accompanied by some chemical detector, right? So you want to detect some of the chemical component as well. Okay. Any other use case? Anyone from mechanical engineering here? No? Okay. So it can also be used for this kind of product inspection, right? So assembly lines, X-ray CTs can usually tell like small fractions of some metal, right? If there's any internal, artifacts, right? So we can using these images to help us to identify those artifacts of these products. So that's also used a lot in the industry. Okay, so that's X-ray. Any questions so far? All right, cool. Okay, so next we'll talk about CT, right? It's short for computed tomography. So basically the imaging, principle is the same, right? So using the ionized radiation to generate these images. But CT, you can consider this is more advanced X-ray. So the basic difference is that the CT will using more dosage of radiation, and also it will produce not just a single image, X-ray image, will produce multiple images. We call this slice, right? So here is a figure, kind of give you a sense, right, how CT machine working, right? So you basically have like a ring-shaped, call this like gantry, right? So you have the X-ray source. This will rotate around the body, right? So this patient is lying on the table, and these gantry will rotate around the body so that you can take multiple scans of the human body, right? So with all these slices, then we can basically generate a 3D volume, okay? Sometimes we also will administrate this called CT contrast agent, right? So a lot of these like dense structures, like bones, can be easily imaged, but some of the soft tissues may be difficult, right? And some of the contrast may be not very obvious. So one way to mitigate that is we can, have some intravenous contrast agent, right? Usually some iodine or other dyes material. So that can be either you can, taking orally, right? So if you want to do some examine your abdominal region, right, the stomach, right? So that will go through your stomach, so that can make the contrast more obvious. So if you want to imaging, like the blood vessel, right? You do the injection of the contrast into the blood vessel, because the blood will go flow all through the body, right? So that can also show very clear contrast of the blood vessel and other tissue area. So here is an example, right? So on the left side, this is the CT image without contrast agent. So here the goal is that we want to basically examine this aorta, right? So basically that's the largest blood vessel, right, with the artery. And if you look at this image, right, so here the aorta is right here, near the spine. And you can see that it's not really easy to, differentiate this aorta from other organs, right? So this liver or maybe some kidneys here. But, on the right side, if we using the intravenous contrast, right, so you can immediately see the difference, right? So these aorta are showing very bright. It's really easy to spot, where this aorta is. And because we are using this kind of injection contrast, you can also notice, right, this kidney, right, especially the left and right kidney, also showing very bright as compared to the left. And the reason is that, this kidney will filter your blood, right? So if you if there's contrast has been injected, then this blood flow, or later this contrast will be filtered by your kidney, right? So it has a lot of residual here. So it's also kind of enhance the kidney and also the liver region, right? So this is the kind of the advantage or the benefit of using the contrast agent, so that some of the specific organs or tissues you want to be highlighted can be easily see on this resulting CT image. And this shows different type of the CT image machines, right? So you have this kind of open armed, like a C-arm machine. So it's not a closed. On the right side, this is a very more common one. So you usually like a donut shape, right? Ring shape. So this is a closed CT scanner. And on the bottom, this is called the micro CT, right? So this can be used in the in the industry, right? So as I mentioned, right, you maybe have to using this CT scanner to detect some of the artifacts of the certain product or material. Okay. So next, I'm gonna show you a short video trying to demonstrate or give you an overview, right? So how the CT scan has been given, right? What kind of procedure we have to follow and how the whole process is. So let's take a look. May have to using the volume.
A CT scan, also known as a CAT scan or computerized axial tomography, is a painless diagnostic test that uses X-rays and computers to create cross-sectional images of bones and tissues inside your body. Your doctor may recommend a CT scan to examine your body for any of the following: blood clots, broken bones, cancerous tumors, infections, internal injuries and bleeding, and signs of heart and vascular disease. A CT scan helps your doctor select the correct location for surgery, biopsy, or radiation therapy, check the treatment of cancer or heart disease, and check your condition after surgery. A CT scanner is a large square or round X-ray machine with a tunnel through the center. During your CT scan, you will lie on a table that slowly passes through the tunnel. As you move through the tunnel, a giant ring called a gantry will rotate around your body. The gantry contains a tube that will release X-ray beams and detectors that will measure the amount of radiation absorbed by your body. The X-ray beams will capture many views of your body from different angles as the gantry spins. The detectors will send data to a computer that will create cross-sectional images of the bones and soft tissues inside your body. The scan allows your doctor to see the location of a condition inside your body, which will help them decide how to treat it or to see how well your treatment is progressing. In some cases, you may receive contrast dye before your procedure in a drink, an injection, or a barium enema to make it easier for your doctor to see certain areas of your body. If you received a drink with contrast dye, your esophagus or stomach will be highlighted. If you received an injection, your blood vessels, gallbladder, liver, or urinary tract will be highlighted. If you received a barium enema, your large intestine will be highlighted. After the procedure, you can resume your normal activities. If you received contrast dye, drink plenty of fluids to help your kidneys remove the dye from your body.
Okay, so that's the procedure of the CT imaging. And then next, we also have a clip showing actually a CT scanner, spinning at the full speed. Actually, you can see the internal structure of the CT scanner. So let's take a look. So you can see how this will rotate, right? So and taking all these, these X-ray emitting all these energies and taking different cross sections of the human body. Okay, so that's this one. Okay. Okay, all right. So now we know how these CT imaging is being performed, and let's look at the actual kind of volumetric data, right? So it's in nature. This is a 3D volume of the CT scan, right? So because we're taking so many slices, and we have taken from different cross sections. So here we're showing basically different views, right? So we have this axial view, sagittal view, and the coronal view. And these different view terminology, so we can here are showing this. Before we determine different views, we have to get to know this kind of anatomical space, right? What are the directions? So we have the left and right. And we also have the anterior, posterior, right? So because basically it's like a front and back. We also have the inferior and the superior, right? So the top and the bottom. So the left to right will give you a sagittal view, right? So you can see this is like a left to right cross section, right? So this is your sagittal view. And for the coronal view, basically it's like a frontal view, right? So the front and back, this cross section. And the axial view basically is like a top-down view, right? So you're being on the top. So this is the corresponding a CT image, right, for these three different views. So in this case, when we read these, CT images, right? So basically, each pixel will have not just x, y, right, the spatial coordinate, but we'll also have like a depth, a third dimension, right? So we also have the z coordinate. Right, so we have an X, Y, Z, showing, like the volumetric location, and each one indicating a specific intensity. And we can using CT images. Basically, one of the fundamental usage is we can detect different type of tumor. Right, so this is a liver image, a CT image from a liver tumor segmentation challenge, right? So here, this red showing the normal tissue of the liver region, and the green shows you the tumor region, right? So this is like a segmentation mask. Then we train our AI algorithm or machine learning algorithm trying to detect the tumor. And we can also using CT images, right, to diagnose different conditions of the lung, right? So these are different conditions of the lung. And finally, we will do a quick summary of the X-ray and the CT, since they basically share the
yes. CT images we get from different machines, so they are from different software. Do they form uniform images? When we do the machine learning algorithm on image segmentation, so we need data, right? So the images we get from the CT machines and the software, are they uniform, or are the different machines have the different type of images?
So the question is, let me try to understand your question. So your question is, are different machines will produce the same image? Is that your question?
Yeah, kind of.
So the answer is, yeah. So the general principle is the same. So like the denser, tissue or the region or the structure will be showing bright, and the less denser, like the soft tissue fluid, will showing as dark. But not all this different CT or X-ray scanner will generate different images because of the parameter they use. So there's, even if we are using the same machine, right? So I'm using like a GE X-ray or CT scanner, the doctors or physicians will define some certain parameter, right? So then different parameters will result in slightly different reconstructed image. So the answer is no. So you won't produce like the identical images from different X-ray or CT machines. So even sometimes you today going to the same location, the same machine for the CT or X-ray scan, the next time you go, maybe you can also generate some different because of the parameters. So yeah, this is a really good question. A lot of time, like when we design a machine learning algorithm, the machine parameter can also be considered as a prior knowledge, right? So you want to take these parameters as some of the prior knowledge to guide maybe some of the detection, right? I know this is a low resolution CT or X-ray, and can take the parameter, generate this kind of low resolution to help you to guide the machine learning model. So yeah, so that depends on the machine. So it's really, so that's why we need these. If you go to the X-ray or CT, there's always dedicated operators, right? Set up the machine. They take some time to set up the machine, set up the room, and also set up some of the parameters on the computer, trying to make sure the resulting image provide the best diagnostic quality for the later doctor, right? Otherwise, if you take low quality images, then it's useless for the doctor, right? Okay, so here is a summary of the X-ray and the CT, right? So basically how it works is for the X-ray is a single X-ray beam will pass through the body and create a 2D image like a shadow. So the pro is it was quick and widely available, right? So you can take an X-ray image, within a minute, right? So that's really quick. And it's low cost and has a lower radiation dose. And because of these, and there's also some limitations, right? So like overlapping structure can hide some of the fine details and what has limited soft tissue detail because of the low radiation dosage. And the common usage is, for the, chest lung check, right? The fraction check and the basic skeletal examinations. And for the CT, we're using multiple X-ray projections, taking at different angles, and to reconstruct into this cross-section slice and becoming a 3D volume. So the pros is detailed and have slice-by-slice view, and has better soft tissue contrast, and has 3D reconstruction capability, right? And the cons are a higher radiation dose. So sometimes this, people will have concerns about, taking the CT scan because of the high dosage of radiation. There are studies showing that maybe if you are taking CT scan in an early age, there will give you increase the risk of getting the cancer in the later age. And the CT scanners are more expensive and large equipment. So usually you need a dedicated room to house the CT scanner, right? So you have an operation room for that. And use cases such as trauma assess, right? Tumor detection, vascular imaging, and surgical planning. Okay. So that's the CT and X-ray. So next we'll very quickly talk about ultrasound imaging. So because this is a really simple and easy to use imaging modality, right? So one question I have is sound frequency. What range of sound frequency a human ear can detect, right? In terms of hertz. Anyone knows? Yeah, 20 to 20K hertz. Okay, that's good. So the ultrasound is defining any sound wave that is above 20 hertz, kilohertz. Okay. So in the early days, right, we may learn from our biology class, or we learn this from the bat, right? So they are using this kind of ultrasound basically to navigate and they flying flawlessly, right? And later we adopt this technology for marine navigation, right? We're using this echo to localize, to navigate underwater. And this technology came into medical domain in 1950s. Right now, we have a lot of devices. Right, we can using ultrasound to diagnose gallstone, kidney stone, and this also be used in OBGYN. Okay. So basically, right? So you have this transducer which will emit, sound waves, right? So some of the wave will be absorbed by the tissues, then some of will be reflected, right? So reflected, the sound wave will be picked up by the transducer again. Then we're using that signal to basically reconstruct image. Okay, so that's the basic principle of the ultrasound imaging. And how does it look like, right? So for different tissues, different matters showing on the ultrasound image, right? So basically, if it's a fluid, right, so it can be transmitted, then it will show on dark on the ultrasound image. And if this is a bones or air, will show as bright on the ultrasound image. So any in between, like soft tissue, muscle, and fat, will show different shades of gray. And some of the characteristics of the ultrasound images is it is low resolution and has low SNR. So SNR means signal to noise ratio in some of the deep region because its sound wave is hard to penetrate into very deep region. But it does have some ability to imaging soft tissues, right? And we can provide it can provide imaging in real time, right? So if you have been to ultrasound, right? So the doctor is actually moving the transducer around your body, then it will display the imaging in real time, right? So this is to using the ultrasound to detect these gallstone, and we can also using ultrasound to detect the kidney stone. So that's also the common imaging modality the doctor will also administer if you have a kidney stone. We can also using this ultrasound, right? The fetal ultrasound, what I call sonogram. So we can, imaging this fetus, right? So even in their very early stage, right? How this fetus, grow over the time. And we can also using ultrasound, right, to measure like the bone structure, the fat, all these things. And finally, we also have this use ultrasound for the breast cancer screening, right? Typically we're using mammography, right? So which is X-ray, but taking X-rays will take a longer time because the device has to be operated in a certain ways so that we can imaging the breast at different angles very clearly, so that we can using that to do some of the diagnosis or detection of the breast cancer. Easy way is we can using the ultrasound, right? So we can also generate these breast ultrasound images, and we can using machine learning algorithm to do classification, detection, or segmentation. Okay, so actually there's a data set. So these images were taken from this data set, breast ultrasound image data set from CAGO. And recently there's a paper actually developing this foundation, generated model for breast ultrasound image analysis. So if you are interested in breast ultrasound images, right, for breast cancer detection or screening, so you are welcome to take a look at this particular data set. Okay, so there's a couple of benefits of ultrasound imaging, right? So most ultrasound scanning is non-invasive, right? There's no needle or injection. And ultrasound is widely available, easy to use, and less expensive than other imaging modalities. And ultrasound imaging is extremely safe, right? Because it does not using any radiation, it's basically using the sound wave, okay? It will provide some clear pictures, and will also, doing this kind of imaging in real time. But also there's study also, kind of provide, maybe there's some potential risk of ultrasound imaging, right? Although, it's not like the CT or X-ray using ionized radiation, but the ultrasound energy has potential to produce some biological effects of the body. And sometimes it will maybe heat the tissue slightly. I've never taken the ultrasound, so I don't know if there's going to be heat, but I'm assuming this could be easily mitigated, right? So there's some gels to cool down your tissue. Okay, so finally, I want to also show a particular software that is able to, you can play with a couple of these imaging data and to show, right, so what this X-ray or CT look like, okay? So for this example, I'm going to take one specific data from this kidney tumor detection or segmentation data set. And this software I'm using is called ITK Snap, okay? Let me end this. Okay. Okay, so this software is called ITK Snap. So I think they have the Mac or Windows version. So you can choose which version or whatever the hardware or the platform you're using. So just want to give you a quick sense, right, how we can, using the software to examine some of the medical data and what we can do from there. So I'm going to open an image. So I actually have one here. So again, this is the kidney CT image, okay? Okay, all right. Quick question, what is this view? Axial view, how about this? Okay, great. So it shows all these three different views, right? So, and if you you kind of click your mouth, right? Moving. Imagine this. You always imagine this is a 3D data, right? So you are, I don't know if this is a good term. You are cutting through this, right? So then what you see is that, okay, if I don't cutting through the coronal view, I only do this here. If I'm moving, you only see, these the sagittal view, right? So they show different cross sections, right? So if I place right at the spine, right? So which shows very clear right here, and supposedly you are able to see all the spine on the sagittal view, right? So what is this area? Lungs, right? Because it's all air, right? Right. Okay. What about this one? Liver. Okay. And so here we are interested in kidney. Where are the kidneys? Maybe I should move. So if you're not sure about kidney, one way is, since this is doing the segmentation, right? So we also have the ground truth segmentation mask of the kidney. So let's also load the labels, right? So we have this file called case label. So we'll open that. Okay. So if you want to also see a 3D, because the data is in 3D, and the segmentation should also in a 3D, right? So you can view, we have two kidneys, left and right, and the green volume will indicating the kidney tumor. Okay. So why I only see one here? So I have to move right to the right cross section so that we can see both of the kidney. And if we keep going up, then we actually see, so there's a tumor on the left kidney, right? So you can actually play with this and see how different slices. So basically, see different locations, see different slices, right? How these tissues, how these being, how they are different from each other. And there's also some function, I don't know if you can see the text here. I think maybe it's very small to see. This is kind of zoom to fit. You can also zoom in. Did I do anything here? Okay, yeah. So you can also specifically zoom in to some specific region and see that. If I want to only see this, you can switch to like a single window view, zoom to fit. So you can basically just look at this sagittal view, right? So maybe you can click on different part, and on the left side you can actually see the location, right? So the cursor, right? The XYZ location, and also you can see the intensity value of this particular location. Okay. Let's go back to these different views, and so one thing I was trying to understand, let me zoom out. So we've talked about contrast, right? So like if I want to examine or detect if there's a tumor, I want to see if like on the pixel level, right, the intensity, if there's a significant difference. So when I actually do this, I feel like, this is actually a tumor region, right? So I'm on the green region. So I think maybe this is very small to see. It actually shows the intensity of 22. But if I click on the red, right, so the intensity doesn't change too much, like 39, right? So actually you can, if I remove the segmentation, unload segmentation, right? So the tumor region, which is here, I just showed this is a green, right? So actually very close to each other. But so maybe, I don't know if we need to using some sort of contrast, right, to make contrast agent so that the image can be more, distinguishable, right, between the normal tissue and like the tumor region. But just to give you a sense, right, so this dark region, totally black, actually shows the intensity value of negative 873, right? So the scale, let's also show one on the very bright, right? So this one is 984, right? So it's actually have a very wide range. So when you're doing the processing, so you have to think about maybe normalize the data. So some of the technique we'll later introduce. So, but I think this software will just give you a sense, right? So you can play with these different data just to get a quick overview or glance, right? How these different different slides look like, right? How it will evolve. And also you can load this segmentation, trying to see, different, if the normal tissue and the tumor tissue region will have very significant, difference in terms of this pixel value. Okay, so that's a very quick demo for this, software. So, yes.
Is that intensity value something that's measured, or is it kind of like an arbitrary color value?
So this is actually measured. So that's displayed. That's actual intensity value of the image. Yeah. Yeah. Yeah, but I think one thing you should get out of this class is, you should get a sense, right, how to, you may brag to your classmates, right, I can read a CT scan now, right, so I know these different terminology, and I was able to, trying to tell, right, which is which. So, and we can using this software, right, to do a very quick examination of these images, okay? All right, so I think that's pretty much it for today. So if you're interested, you can download this software. I think it's for free. But of course, you can also using these like a code, Python code, a lot of toolbox to read this and also play with the image. But this software give you like a single place, easy to play with, just to give you some quick sense how these images are look like. So next class, we'll talk about MRI, functional MRI. Okay. So any questions before I end? Okay. All right. Thank you.